Hello and welcome to webinar series. Myself Shanti, and today's topic for discussion is all about nursing fundamentals, and are these basic fundamental skills are essential for providing quality bedside care. For this discussion, I now welcome Mr. Professor Emmanuel from Navodaya College of Nursing, Raichur. I welcome you, Emmanuel. Emmanuel, are you there?
Thank you, ma'am. Thank
Yes, I request everybody to just unmute yourself. Yes. Can I see you, Emmanuel? Okay, going ahead, let us also welcome Mr. Nagesh, who is our nursing officer from Pandit Madan Mohan Malviya from Varanasi, UP, Uttar Pradesh. I welcome you, Nagesh.
Yes, ma'am. Good evening, ma'am. Thank you, ma'am. Thank you for offering.
Thank you. And it is very, we are also excited to see one of our fourth year student from Raichur Navodaya College of Nursing, Miss Ashika, participating in this webinar. I welcome you, Ashika.
Thank you, ma'am. It's truly a honor to be part of this prestigious webinar. Thank you, ma'am.
Yes, thank you. And we are honored to have such a wonderful group with us today. Going ahead, first insight we would like to understand from Emmanuel. Do you still believe that nursing fundamental skills are still essential in today's technology-driven healthcare? Yes, over to you. We are going to keep this time-bound session. Over to you, Emmanuel.
Yeah, thank you, ma'am. First of all, I would like to thank Yashoda Group of Institution for giving me an opportunity to be an expert speaker on this. And yeah, fundamental nursing is very, very important.
I think there is a technical glitch. Can you hear?
World, because
Yeah, continue, Emmanuel.
that I say. Yeah, second thing is what I feel is there can be errors even from the technology or the instruments that we use, but only the nurses can be able to detect it early, and they can report it, and all those things can happen over time. So I believe that is one of the important skill that all the nurses should given a basic fundamental thorough the technological assists.
Yes, very greatly. I could hear few of your insight, and if you were skipped, I think there is a little technical glitch we are experiencing from your end. Yes, going forward, the question or insight we would like to understand from Nagesh, do we learn best through practical experience, which always happens at bedside? Yes, Nagesh, over to you.
Yes, ma'am. Thank you for a great opportunity to me to conduct a webinar. Ma'am, during the clinical sector, while practicing at the bedside, this through practical experience we can learn like many clinical knowledges. That like examples of while taking vitals through the cardiac monitor to the patient. If anything happens like any abnormal vitals, if a fundamental, those nurse will have a fundamental skills, she can reassess the patient status as well as the connection to the monitor which is connected. So these will makes like accurate data with the practical experience.
Yes, yes. So we, these scenarios are randomly seen bedside.
Yes,
Sometimes,
ma'am.
sometimes in case of any technical glitch, the
Yes,
nurse gets a panic and she, directly calls the doctor. Before itself,
yes,
she
yes,
should assess few technical glitch. Yes, in terms of accessories of monitor, etc. Yes.
yes.
Going forward again, this insight we'd like to understand from our beloved student. Is it essential for every nurses to know and apply fundamental skills? Yes, Ashika, what is your, insight on the same?
Yes, ma'am. First of all, thank you for all giving me an opportunity, especially the organizers and the expert speaker, and everyone for giving me an opportunity. Yes, ma'am. It is very essential to be knowing and applying the fundamental skills in nursing. As we all know that, as in knowledge without application is no knowledge. That is, application of knowledge is very significant to bring a brighter outcome in the skill training and learning initially in the student nurses and in the field of nursing career. For example, in the case of NG tube insertion, the nurse should have some fundamental skills like patient positioning and preparation skills like patient identification, explanation, hand hygiene. We cannot delete, or we cannot have the we cannot perform without having the hand hygiene. Before and after, we need to perform hand hygiene to control and to control the infections and to prevent the other trans or cross infection from the patient. After the insertion, we need to aspirate gastric content and check the pH level. It should be acidic, so it is very essential, ma'am.
Yes, I think these are the very basic fundamental skills, and everyone should know about this. Yes. Going forward, does technology assist? I mean to say technology assist, but nurses bring human touch. Yes, over to you, Nagesh, for your insight on this. What do you think nurses brings
Yes.
human touch in spite of
Yeah.
having a lot of technological advancement in the hospital setup? Yes, over to you.
Yes, ma'am. Technology also is the most important role, as well as more than that, that human nurses, human touch is the most important in the role of the disease conditions of the patients, especially with the dealing with like oncology settings. Especially the patient will have those who are having anxious about their diagnosis and treatment and conditions. There, the nurses should have the spiritual and emotional support with the touching of the patients. This will make the patient to comfortable and fast and speedy recovery to the patient. So these touch cannot replicate the technological things. So this is
Yes,
very essential for the nursing practices. So
yes.
fundamental skills are more essential than this technology human touch.
Yes, and what is your insight on the same, Emmanuel? I wish you would like to add a few points from your end as you're the professor, and under your able leadership, many students are getting mentored by you. Yes, over to you for your assessment. I mean, for your insight. Yes, yes. I think we are experiencing the technical problems from Emmanuel. Emmanuel, can you hear us? Okay, going forward, when the Emmanuel can always come back. Yes, Ashika, this is for your insight. What stops nurses in maintaining fundamental skills? I agree that we all want to learn fundamental skills in terms of, doing before any procedure or identifying if at all patient is experiencing bradycardia, etc. So what stops you all for not learning and maintaining? I mean, learning is important. At the same time, sustainability and maintaining those skills are very important as well. Yes, over to you.
In my perspective, ma'am, limited real-time practices opportunity will stops the nurses from performing the fundamental skills. I think in nursing, real-time practices is nothing but performing skill directly with actual patients in clinical areas. When nurses doesn't get enough time to perform their skills in this way, it becomes a major barrier to skill development. And in
Yes.
case as a student nurse, we spend many more time in observing things than actually performing the procedure. Without the repetitions in the real scenarios, our confidence and proficiency can reduce. And in some cases, like a teaching centers and a training centers, there can be too many students and staff and not getting enough patients. So as a result, the
Yes.
students have to wait or miss out a chance to practice now. So in my case, limited real time is one of the thing that stops in us.
So every given opportunity, you all should practice, learning by doing and doing by learning is always important. So that in professional front, you all will be very confident in giving good patient care. Yes, yes. Emmanuel, are you audible? Emmanuel, okay. Now we'll again, understand from Nagesh point of view, like what happens, what stops senior nurses in maintaining or retaining this fundamental skills. So they may be very sound in doing patient care or handling any technology. Yes, what
Yes.
happens in case of senior nurses, as you are one of the senior officer? Yes, over to you.
Ma'am, thank you, ma'am. Actually, the seniors or senior nurses will have the more knowledge and experts in their specific knowledge in during bedside practices. But day by
Yes,
day, they are getting the lot of experience, the lots of workload and lots of heaviness in the works and lack of opportunities. And this will makes them to be this will makes them to be lost their interest towards the patient care.
yes,
So
exactly.
for
As
this,
they know, yes,
yes, for this we need to always institutional things. Institutional people can give their career development and professional growth and development needs to be, and as well as the personal stress reduction strategies also need to improve for the nurses. That will make the for encouragement and motivation towards lack of this interest and all.
yes, I think that is the reason we request all the senior nurses also to go for refreshment course. Like,
Mm.
always they can learn. It is not
Yeah.
necessary that they should not learn the fundamental skills. Learning from the
Mm.
juniors, learning in the labs, learning with the hands-on is always important, Yes, over to you, Emmanuel. Are you audible, Emmanuel? Can we ask you? Yes, a few more, points which we wanted to, also what stops nurses? Time limit. Time is again big factor. I think time limit, and because of the reliance on this advancement of technology, nurses are bound to, forget the skills which they, learn bedside. I think there is a problem with the Emmanuel's thing. Okay, going forward, this for your opinion, do nurses need fundamental skills to pass all kind of MCQ based OSCE exams, may that be national or at international level? Yes, over to you. And I know
Mm.
about you. You have cracked all your AIMS exam, and you have come to this state until so far. Yes, over to
Yes.
you. Yeah.
Yes, ma'am. Thank you for the opportunity. Ma'am, thank you. This fundamental skills and clinical skills is most essential for the nurses to build their confidence as well as to clear the competitive exams. So this is more essential.
Yes,
Hello,
you
sir.
mean to say all the because without
Sir.
clinical skills or
Yes, sir.
fundamental skills.
Yeah,
Yes,
ma'am.
Okay.
yeah, yeah. So, yeah, Emmanuel, are you okay now? Okay. Now the question remains the same. How do how to improve the skills, and are this skill are essential today? Yes. So what is that core fundamental we need to practice, Nagesh? What is your opinion?
So
What makes
practice
you perfect, or what makes you improved day by day bedside? What is your core fundamental mantra towards the same? Yes.
practice regularly and attending of conferences and workshops and continue educations and bedside in service educations also update our knowledge, and this will improve the skills of clinical skills as well as basic fundamental skills also, and always don't depend on the technology or the manual technical skills also is very important during the practice of our nursing profession. So this
Yes.
will make.
So how many of us witness nurses checking the respiratory rate of the patient?
Yes.
Now, as technology proves that yes, everything is taken care by cardiac monitors, saturation probes, and ventilators, vagara, vagara. Yes,
Yes.
how many of the nurses at this at current generation, they know manual method of checking the respiration? Yes, so over to you, Emmanuel. Do you have
Uh,
your input to say yes?
yes, ma'am. Can you hear me, ma'am? Am I audible?
Yes, yes, I can hear you.
Yes. I think more than I think there should be an emphasis on making the students or the nurses to know the basic parameters how to check manually. Only if they
Yes,
are able to understand and interpret the variations, only then they will be able to understand what is happening even with the machines. So
yes,
therefore, what happens is it should be done or taught. It should be in the manual or non-technical this thing, madam. without
Yes,
the use of technology.
yes. Though we handle technology or machines, but one should not forget the basic fundamental skills of checking, pulse rate or heart rate or respiratory rate or the right amount of practicing or tying the BP cuff. Yes, yeah.
Yes, yes,
Going
ma'am.
forward, yes. Now, as nursing students enter the profession, before they enter the profession, what guidance would you like to suggest to help them succeed? As you mentor a lot of students under your able leadership. Yes, over to you.
Yeah, I feel every nursing generation had its own unique challenges, and I feel even today we are very advanced in the kind of OSCE and checklist method, and even simulation is happening now. So I think
Yes,
we should be able to train the nurses in all these areas, and also there are some. Institution that are incorporate real-time practice, and
yes,
so even though there are some we should improve the quality of education by adhering to the practices and the guidelines that are given by the nursing council, and
yes,
by doing this. And one more thing what I would like to add is we should inculcate the passion to practice and the
yes.
passion to learn continuously.
Learn.
And therefore when you have passion, you have a purpose, and passion with purpose, I think you can be able to do wonders in the practice. I mean, especially the young nursing students who are very
Yes.
enthusiastic in learning and implementing the skills.
So,
Yeah.
what do you see? What do you experience at your setup, at your facility? When you validate few things like, passing out students are, really doing well, and as a, professor, you validate their practices. What do you experience? Do they pick up very easily, or do you still face the challenges? Do you still have to give a remodeling of training, etc.? Yes.
Yeah, we have challenges at every year, every different level of nursing course. I mean, every first year students have different needs of
Yes.
learning, second year, third year, and final year students. Compared to first year, for final year students are obviously better, but
Yes.
still not better to be able to groom. This is, I'm talking in a general note, but
Yes.
we
Okay.
here in our institution try to kind of be very intricately work on the passing out skills. We have community postings and even skills, even in the community areas also we teach students. And even we have simulation center, one of the finest I can call in entire North Karnataka. We
Okay.
even have simulation sessions for the outgoing students, and that's how we train our students, madam.
Yes, a very productive, input you have provided. Yes, we have come to the end of the discussion. Last insight we would like to understand again from our beloved student Ashika, what clinical skills nurses should use when patients refuses treatment or care. I think this is the scenario which we all experience. Even I have experienced, and you may also experience, or sometimes as a student, few patients they refuse care. If you would just go to bedside for mouth care or some ambulation or post-operative dressing, etc. So what is your take on this, Ashika? Over to you.
Yes, ma'am. As a student, as a nurse student, I truly believe that the nurse is not just a nurse. She should have some qualities like active listening. It is the thing that a clinical nurse should have in the case of refusal of the medication. Active listening, and the nurse should be response in a manner of empathy. Not
Yes,
not the point, not sympathy. The nurse should have empathy. Rather than the nurse should have empathy, understand the patient concern and the feeling behind the refusal. The nurse should know about the behind the reason of the refusal. Listen without, the nurse should listen the patient without interrupting. And I think the nurse should maintain an eye contact with the patient and reflect. We need to reflect their emotion. Then only they feel comfort and to speak up. They will have this courage to speak up if we are maintaining an eye contact, as we are
yes,
reflecting a thing. And we need to counsel or educate the patient to ensure that the patient has the clear information regarding the treatment consequences and about all the refusal. That's it,
yes.
ma'am.
And Yes, a very valid thought process you have provided. Yes. In such a scenario, always we can just little provide the gap also to the patient.
Yeah.
We can always come back and again, recounsel them. And we urge all the viewers, these scenarios to be documented as well. Even right, because the patient has a right to refuse, but as you said, by listening to them and counsel and explain the risk and benefits, then I'm sure patient will definitely adhere to the medication management. Yes. Well, that was very productive session, and the 15 to 20 minutes time bound session. It is not very great enough to be done with this fundamental skills topic. But I really thank each and every one of you. We really enjoyed our session, and we will connect further. And I urge you all to whatever we learn, we'll have to always pass by sharing the knowledge to all of your batchmates and colleagues, and keep sharing the views. Yeah. At last, I like to thank everybody, Nagesh, Emmanuel, and Ashika. Well said.
Thank you, ma'am.
Yes,
Thank you so
Emmanuel.
much.
At last, would you like to, give your conclusion insight for all the viewers, even viewers who are also freshers, in very short? Over to you, and then we end.
Yeah. I feel despite whatever the technological advancements are happening all over, we see AI and so many things in nursing modalities. But I feel somewhere you cannot replace human touch, human judgment. Machines cannot overtake human judgment, no matter how intelligent the machine may seem to be. But at the patient level, there should be the touch of human, and also the reasoning skills what we have that are happening consistently changing at the bedside can be caught by the nurses who are really skilled, and therefore emphasis should be done on training the nurses on the fundamental skills. And yeah, as we see, the technology can only be a supplement, but we cannot
Yes,
completely rely on the technology. And
technology.
therefore, having said this, I see there is a greater importance that nurses should definitely be trained on the basic nursing skills before they start using advanced technology.
Technology, yes, a very
Yeah.
valid point. And yes, thank you. We are just, going to end the session. Thank you, Nagesh. And we all will stay connected. Thank you, Ashika. We end the session.
Thank you.
Thank you.
Thank you,
Okay,
ma'am.
ma'am.
Thank you.